Mariah is 2 years old. She loves to play. She's very shy in the beginning, but once she gets to know you, she'll let you know her true self. Her true self is very outspoken. She loves to tell you what you're doing wrong, how to do it, and just always giggly. She's the princess. She has everybody wrapped around her little finger. The dog kind of looked at her in a certain way that got me nervous, and that's when he turned around and grabbed her face. I was basically in complete shock. I kept thinking, she's lost way too much blood already. By the time we get to the hospital, I didn't know what was going to happen. And they told us her condition was too critical, so they would have to fly us to Loma Linda. When we arrived to Loma Linda, when we landed, I asked if I can lay with her to comfort her. And she turned around and told me, it hurts. That's when I lost it. Because I've always told her that I'd protect her. And I felt like I failed her. I wanted to be the one to get attacked. And I'm pretty sure any mother would love that. Mariah is the kind of person where if you're crying, she goes to hug you. And she'll say, it's okay, don't cry. So I felt like that was my job, to do that as a mother. To go up to her and tell her, it's okay, everything will be fine.
We heard that she had a severe dog bite and had part of her face avulsed, and then we were able to, see pictures and determine that was her entire nose and upper lip. And it had been a number of hours since then, and so we had to determine if it was worth trying to re-implant it or not.
This is something that has to be replanted within a matter of hours, and so the decision has to be made very quickly.
And it had been within that time period, so we decided right away just to come in, Dr. Peterson and I, and get the rest of the team together to try and do this.
When Mariah went in, they said that this was a procedure that probably wasn't going to last.
You kind of have this realization that it's either going to go probably really well or really badly. If the tissue doesn't take, there's going to be basically an impossible to adequately reconstruct a defect right in the center of this person's face for the rest of their life. On the other hand, if you're able to successfully replant the tissue, it's the greatest result you could hope for.
My worst fear was getting a call, getting to the hospital, and not being able to see my daughter again.
Dr. Peterson and I worked together to put the arteries together on each side. So, he did his side, then I did my side, assisting each other. That was really key, is because of the size and the technical difficulty of it under the microscope. And then once we got it back together, our thought was, well, hopefully, this works. Like, we've done our best. Now we have to rely on leeches. We have to rely on, the intensive care unit, and hopefully this surgery will be a success.
Around 1:30, I got a message saying surgery is now over. Mariah's doing great. When I asked them how long should I expect to stay at the Ronald McDonald, they told me, in her condition, you'll probably be staying there for quite some months, probably 2 months. Expect more. And Mariah's so lucky to go home 3 weeks later.
I mean, it's remarkable.
This size of facial avulsion is very unique. Given her age and the size of the avulsion, it's one of the largest avulsion injuries successfully re-implanted in a patient this young.
This is fairly uncommon, and just the nature of the injury was also quite uncommon. It's really the first that I've heard of in the United States.
She really is doing well, and I start back in the office, and that's just great, because that's what you really want. You want her to just be able to get back to being a kid.
We knew if this worked, then she would be, make such a difference in her life. It's hard to imagine what she'd be like without it working compared to what it is now. There's some things she's going to have to deal with scarring and things, but compared to having your whole nose and your whole lip gone, it's just a remarkable difference. And so to have that work and to be a part of that, it's just very rewarding.
replanting Mariah's facial tissue is definitely the most intrinsically rewarding case that I've ever done.
I think that it just makes us feel the joy why we actually went into medicine, to help others, and especially small children. Without individuals or corporations that support the Children's Hospital, this certainly wouldn't have been possible.
The nurses, the doctors, everybody that helped her out, I'm very thankful for every little thing they did for her. They got done so fast, and the outcome is so amazing. I think Loma Linda is the best hospital that any parent can ask for. She's home, and she's perfectly healthy.